everyone. Welcome to week number 8. This week what we will be focusing on is prepping a patient exam room, the medical record, and how we chart in the medical record. So this week is really going to focus on chapters 13, chapter 36, but just page 824, and chapter 56. So let's get started. Chapter 13 is really dealing with the patient medical record. Okay? It's important to know that the medical record is a legal and permanent document, and that according to HIPAA, the medical record is really owned by the patient. Okay? And they get the approval to say who we share things with and when we share things. Okay? You always document every time and everything done with a patient, whether it's in a visit, whether it's in a telephone call, an email, a face-to-face encounter. It does not matter what it is. You always document everything that happens. Because in the medical world, we have a saying, if it's not documented, it did not happen. Even if you can try to say that it did and a patient can say that it did, if it is not documented, it never happened. Okay? You always want to make sure that when you're documenting in a patient medical record, you always use black ink, and you always date and initial everything. The reason that we do that is because you don't want to have somebody come in after you and try to document under you. And the other reason is other inks are very hard to read, so we keep black ink as our main. We only use red ink if the patient has an allergy to a medication, and that's just so it sticks out so we're aware of that allergy. Okay? You always want to document facts. You never document your own opinion. Okay? Reason being is because that can come back to haunt you, and it actually can cause problems with the patient later on. So always document facts, never your own personal opinion. You also want to make sure that if you make an error in the chart, you never want to use whiteout. Okay? That no longer exists in your world as a medical assistant, as a medical professional. Whiteout does not exist anymore. If you make an error when you're charting, okay, it's normal. People do it. I'm totally guilty of it. I do make quite a few spelling mistakes because spelling is not my strong suit. But if you do make a mistake, what you want to do is draw one line through the mistake. Above the mistake, you actually want to date and initial that and write error. Okay? One line, that's it. You don't have to scribble it out, just one straight line. Then you can write the correction after that. Okay? It's important to know that when you are dealing with the documentation that there is a few different formats that we can use. The 4 different formats are a chronological medical record, a problem-oriented medical record, SOAP charting, and then a source-oriented medical record. So chronological medical records are really something that follows a patient over a period of time, and with each new visit consisting of a new entry and date, rather than by their symptoms. So generally, when we send patients to see a specialist, they use a chronological medical record. Okay? They keep a time frame of when they see the patient, and it's always generally for one symptom, and they keep just seeing them repetitively. A problem-oriented medical record is really where we will identify a patient's problems and we'll organize them in the chart and chart based on those problems. You'll also maybe hear this sometimes referred to as a POMR. It's just a shortened version of problem-oriented medical record. Next, we have SOAP charting. And what this means is it stands for Subjective, Objective, Assessment, and Plan. So what we'll do is we'll organize progress notes based on that SOAP charting, okay, and document under each of those different parts. So the subjective, the objective, the assessment, and the plan. And you can see examples of these in your book, so I'm not going to go too far over them. The last, and probably the most important because it's the most common type of medical record that you will see and probably you will use, is called a source-oriented medical record, or an SOMR. What this really is where you take a patient's information, and it's organized into different sections of a medical record. For example, you have your history and physical, you have your insurance, you have diagnostic testing, you have progress notes. All of these are different tabs within a medical chart that you can chart into. Okay, this is really probably more common than of what you'll use, and even think into when you made charts in class, those are what they look like. They're just like that. Now, it's also important to remember that medical records can either be electronic or paper charting. More commonly now you're going to see the electronic medical records, just because those are really what Medicare and Medicaid want providers and medical staff to start using. Chapter 56 is going to talk really about how we handle patient education and how we give good patient education. So you as a medical assistant are really going to be responsible for doing a lot of that education and really connecting with your patient. Knowing what they will need before they sometimes know what they need will help them. Now, some things you might give education on are things like lifestyle changes, if they need to do a diet or an exercise program, if they need to stop smoking, that's a big one, stop drinking. Those are all ways that we can help a patient. Maybe they're newly diabetic and you need to teach them how to prep for different treatments, or explain to them how they get ready for a surgery or a procedure. Helping them become very compliant with their medications, understanding what the medication is and how they take it will really help a patient become more compliant and start to follow a treatment plan better. And you're also maybe going to help them with disease-specific information. So if they're newly diabetic, if they're a newly hypertensive patient, if they've been diagnosed with asthma, anything they've been diagnosed with, you can help educate them on what that disease is so they have a better understanding and know how to take care of themselves better. All patient education is going to start with an assessment. You need to know where the patient's at before you start giving them information. Maybe they know some of the information already and you don't want to backtrack and tell them things more than once. After that, you're actually going to have that task of teaching the patient. Figuring out the best way to teach them. Is it hands-on? Is it packets and pamphlets? Is it just straight talking to them? Is it helping them by writing things down or making charts and graphs? How are you going to help teach them the information? Okay. Every patient is different, so all patient teaching will be different. And then after you do the patient teaching, you really need to make sure that you document it in the chart so that way you can come back and reflect on it at each visit that the patient comes in, so you know how to be able to track what you've taught them. Okay? Always remember that when you're creating that teaching plan, again, not all people are the same. We don't all have the same learning style, and we don't all learn at the same level. So you need to make sure that when you're doing a patient education, you need to know first off, what the patient's highest level of actual education is. If somebody's only had like an 8th grade level of learning, you can't talk to them like you would at a college or a bachelor's level, okay? You want to make sure that you adjust things and your teaching so that way patients learn best, okay? You might have to also adjust your teaching based on different sets of people that you work with. If you're working with children, sometimes using sticker books or drawings and pictures are easier for them, so they have a better understanding. But then, you have patients with special needs. Maybe they don't learn as quickly as we do. Maybe they have a developmental delay. Maybe they're sight impaired or they're hearing impaired. Maybe they have a language barrier. All of those are going to adjust how we do a patient teaching. You could also have patients who are a little bit older. Elderly patients are one that you'll have to adjust the program for quite frequently. Maybe they have dementia or Alzheimer's, short memory spans. Maybe they don't have the best hearing. All of those are all things that you're going to put into play when you're making that teaching method for that patient or that teaching plan. Now, when you're completing a patient education, you want to make sure that you take a lot of considerations into play. Not just the patients themselves, but outside of them. Think about their culture. Sometimes patient education doesn't go very well based on a cultural or religious belief. If it's something where the patient's going to have to put up more financing, or maybe they have to start a whole new program, it could be hard or strainful on a patient. So we want to make sure that we take into consideration those things as well, because, I mean, think about it. Anyone ever tried to eat very healthy? It's hard. It's expensive. So make sure you're taking those into consideration. Health beliefs. Maybe you have patients who are holistic and only believe in natural remedies and don't want to take medication. That's a big part of it, and that plays into it. It's happened to me quite frequently. Medication errors. You want to avoid any errors. So making sure the patients understand their medication, when to take it, what not to take it with, is also very important for them. And then handling patients who are non-compliant. That's a difficult one, because how do you help someone who doesn't want to help themselves? Okay, that's something that you'll have to learn how to work with, and that the considerations have to take into effect. Alright guys, so that's kind of the basics that I'm going to talk about in the video this week. As always, it is your responsibility to read the chapters in full, because you never know when pop quizzes come up, or I throw stuff at you that you have to learn on your own. So this week in the lab, what we'll be doing is going to make you happy. Again, this week in the lab, we will be doing your homework in class together. And your homework is really working on learning how to properly chart in a patient's medical record, okay? So again, we'll be doing that in class. Along with, we'll also be doing some vital sign practice again and some injection practice. So please make sure that for vital sign practice you bring all of your equipment that you need, your blood pressure cuff, your watch, and your stethoscope, okay? Also, this week you will have one discussion post. And what your discussion post is really looking at is the different types of medical visits or office visits that a patient will have. I want you to research an office visit, and I want you to tell me any sort of maybe screenings that would need to take place before a patient comes in, any preparation that the patient would need to do themselves to make sure that that visit goes smoothly and goes as planned. Your initial post, as always, is due on Tuesday night by midnight, and your 2 responses are due on Saturday. Another thing that I want to remind you guys about is this week your second half of your project is due. So that second set of 10 slides is due this week. Hopefully you guys have been working on that since you turned in your first half, and all you'll have to do is hit submit to this week. You will also have a quiz this week, and your quiz is based on professionalism and boundaries. As always, as I've done in the past, you will have a quiz review in class, so don't panic about it. I'll try to help you as much as I can, okay? You won't have a written assignment, but you do have some other assignments that you need to take care of outside of class this week. Okay? All right, guys, have a wonderful week. I will see you on Wednesday. Bye.